to the Fusionary Health Podcast, where we bring you wisdom on how you can build vibrant health every single day. In these episodes, I'm going to bring you the most incredible practitioners who I have gotten to know so you can hear our conversations that happen behind closed doors about how all of us can really approach our health in a new, innovative, and fresh way. So today I'm excited to introduce to you Susan Winograd. She is a pelvic health physical therapist. She's the owner of Pelvic Core here in Boca Raton, Florida. And as I've gotten to know her, she has so much great wisdom. I end up randomly meeting her patients out and about, and they're raving about her. So Susan, welcome.
Thank you, Shivani. I am so excited to be here with you today.
Thank you. So share with us a little bit about your background and what you do, because I doubt anybody knows what a pelvic health physical therapist does.
Yes, I don't think I knew when I graduated, but I have been a physical therapist for 30 years. And, during the course of my practice, I really realized that there was a need that wasn't being filled, and that was bowel, bladder, and sexual training and treatment.
Sure.
So I gradually got into pelvic health over the years. And then as I learned more and realized how fascinating it was, I really decided to immerse myself just in pelvic health. And I launched Pelvic Core Rehab, I think 8.5 years ago. And it has just been the most incredible ride of really, really enjoying helping people and learning and just bringing our clients what they need, and really just listening and evolving Pelvic Core to be what our clients are asking for. So we treat, we help people with any bowel, bladder, and sexual dysfunction. Okay. We help both men and women. We also do a little bit of pediatrics. And one of the things that I'm really proud of is that we do see men in our practice. We see about 60% women, 40% men. And there are a lot of great pelvic health, practitioners. Many of them specialize in women's health, which is totally okay. But there are so many men that need our help. And I'm so proud to be able to be a resource for them and a source of healing for them.
Sure. And I mean, I'm sure this topic gets sensitive,
Yes.
And so you need a safe space where you can go in and feel good. I've been to your office. It's so soothing there. It's so welcoming. So what kind of inspired you to design your office and space in that way?
That is not such a simple question, Shivani. I had so many of our clients come to us with a biomedical model, a framework or a frame of mind, or, kind of frustration with the biomedical model that hasn't worked for them. Sure. And they're frustrated. They have received fragmented care in an area of health that is so sensitive. Yeah. Many times they haven't been treated the way they would have liked to by medical practitioners. So when I launched Pelvic Core Rehab, that's exactly what I wanted to do. I wanted to create a space that was beautiful and soothing, that felt safe. We purposely don't wear scrubs because Nice. I wanted people to feel as though they were in competent hands, but that there was a little bit less of a clinical feel. Sure. It was more of a safe healing space. So I am really, really proud of that environment that we've created. And I will tell you that I think every single person that walks into Pelvic Core Rehab walks in and almost takes like a deep breath and say, wow, I wasn't expecting this, in a pelvic floor physical therapy. Our waiting area truly looks like a comfortable living room.
Yeah, it does. That's really nice. That's beautiful that you made that conscious decision. It could have been easily, let's do scrubs. It's clinical. It is physical therapy. It's easy. But to make it approachable is a big deal.
Yeah. We wanted a safe, non-threatening, and not scary space. Sure. And we also made a conscious decision to make it gender neutral because we wanted everybody to feel welcome.
Sure.
And we didn't want, ovaries and uteruses and, really, female, male, or whatever else dominant. We wanted everybody to feel like it was like the space that they belonged in.
That makes sense. That makes total sense. So I'm curious, what are like the top few things people come to you for? Because as a layperson who's just this is not my field of expertise.
Right.
I'm very into inflammation, very into sleep, very into Ayurveda, very into self-care. There's certain topics I'm obsessed with.
Yeah.
So when I met you and you said, oh, I'm interested in turmeric, and you have an acupuncture physician in your office.
Yes, she's my co-tenant, Heather. Yeah.
Awesome. So I was like, wow, she's very open-minded into the alternative and Eastern practices.
Yes.
So when it comes to what you treat the most, I just assumed it's like, oh, well, pregnant women have babies, and obviously everyone has issues after babies. So that must be it. But I have a feeling after having met you that that's not true.
Yes. So when we met, just to backtrack for a minute, I was so blown away by everything that you've accomplished with fusionary formulas. And it really resonated with me because you really can't separate gut health from the pelvic floor, right? Those digestive organs sit right above the pelvic floor. And inflammation creates an environment, an inflammation-rich gut creates an environment where healing is not optimal, right? You want to create an optimal environment for healing. And I'm obsessed with your teas, which we can talk about, but everything that you were doing blended beautifully with my healing philosophy. So I thought that was such a beautiful fusion of things that we were able to bring together and help people with. But I treat the most common things that I treat, and of course this is non-exhaustive, but the most common are bladder issues. Okay. So I have had young people that have never had children that have had leaking issues, all the way up to, people that are a bit older. A lot of people don't know this, but a lot of athletes leak urine involuntarily while they're practicing their sport. Wow. So one of the messages that I always like to convey is that leaking is common, but it's not normal at any age. Okay. So that's definitely one of the common things I treat and one of the common messages I try to convey. The other thing that we treat a lot is bowel dysfunction. So constipation, incomplete evacuation, inability to hold back wind, anything that's bowel related. Okay. And we treat any sexual dysfunction. So pain with sex is a huge one it's a big one for women, but a lot of people don't realize that it's an issue for men as well. Pain with an erection, pain before ejaculation, pain after ejaculation. Sure. So it's pain with sex is a big one that we treat. And we also treat a lot of pelvic girdle related issues, orthopedic issues as well. So really anything bowel, bladder, and sexually related is what we specialize in. But as people have begun to hear and learn about pelvic core rehab, we're starting to get a little more orthopedic centric cases as well. Okay.
It's interesting when you said constipation and Ayurveda, we're obsessed with gut health. Mm-hmm. And I know gut health ties to the vaginal microbiome as well. Our microbiome is what's dictating everything. I speak all the time on gut health is brain health. Gut health is immune health. These
Absolutely.
Are all interconnected. In Ayurveda, we teach that we have a digestive fire. And if we don't honor that fire and stoke it and build it every day, we're not going to have the metabolism we want. We're not going to eradicate the pathogens that should not be there. We're not going to clear inflammation overnight, which is key for vibrant health. So when it comes to your patients, it didn't occur to me when you mentioned it, oh my gosh, I want this turmeric. I thought, oh, okay, cool. Like she must have inflamed patients. But it's beautiful that you see and honor and understand the microbiome's connection into.
Yeah. So what I do truly requires that you use a whole body approach. We really are pelvic health therapists, but we treat every system in the body. Sure. The really interesting thing is that the gut microbiome is separate from the vaginal microbiome, right. And they really both need to be healthy in their own optimal environments in order to function properly. Right. So we have to pay attention to both. The gut does a little bit better in a little bit more of an alkaline environment, and the vaginal microbiome does better in a more acidic environment. So usually you want to see vaginal pH around 4.5. So between a 4.5 or the 5 range. So they're different, but they both have to be optimized without inflammation in order to achieve the healing that people truly want.
It's interesting. There's a company that I work with. I love their supplements. I'm super into doctor's level supplements. So I love my own supplement company, but I also love fellow companies who do a phenomenal job. And so there's a probiotic company I love that has a stool test and a vaginal microbiome test. And I have a lot of different women who've reached out to me who are like, I get frequent UTIs. What do you recommend? And what I had understood was it's upstream is going to affect downstream.
Yes.
So it's interesting what you're saying is if someone has a lot of issues, maybe they should be testing both and understanding where is the microbiome having that issue.
Absolutely. That's definitely something that you could look at. But what I think that we also need to realize is we need to really isolate the root cause of what's going on and then maybe try to test for that root cause. Because I think as pelvic floor physical therapists, we can even visualize someone's pelvic floor and say, you know what, or, clients can tell us what they're struggling with. If they're struggling with yeast or constant UTIs, then we start thinking, okay, well, maybe the pH in their vaginal microbiome has risen a bit and we should tackle that first. So we want to really optimize the whole system, but I think that sometimes it's really good to get into the zone of what you really think is going on. And sometimes when you heal the root cause, other things fall into place. And if they don't, then you tackle them. Sure. But very often we can sort of look at a patient and listen to their story and say, you know what, I think we need to zone in here. Yeah. But yeah, I love that more of these companies are coming up with these stool tests and the vaginal test. It used to be only, the GI map test. Yeah. And now there are other really good tests out there as well.
Yeah, which helps. Sometimes data compels people to move forward in a way that just an assessment doesn't.
Correct.
And sometimes just going to the right specialist who can discover the root cause is the key. A lot of my job as an Ayurvedic practitioner is I sit with people, I hear the story, and my whole brain and intuition is just trying to discern what is that root cause issue? And if we can just address the one issue, can we win at everything?
Yes.
And I always try that way first. It's usually my hammer is inflammation. I'm going to approach it with turmeric, or I try to fix sleep. And usually between a few of these issues or gut health, those are my three main topics, will fix a lot of issues downstream.
I could not agree more. And, I agree with what you said, Shivani, about information, but I think ultimately it comes down to knowing the client that's sitting in front of you, because information can also be a very dangerous thing sometimes where you start, my husband's a physician. He always says, if you look, you find.
True.
Right. And so people who may get a test result back and may see some minor imbalances will kind of run with that. When if you would have taken care of the inflammation, those things would have resolved, and intuitively you know that. Sure. So I think, one of my greatest mentors, Carolyn Van Dyke, and she always says that tests should be done to confirm what you believe is going on.
Sure.
They should not, she believes that they shouldn't be sort of exploratory.
Sure.
Because when you go down that rabbit hole, it could be difficult emotionally and psychologically for clients. Sure. If we have to, we do. But sometimes I think, just like what you said, you get so much information by what the client is telling you.
True. Yeah. And I laugh because I have too much information on myself. I have the honor of meeting the Fusionary Practitioner Network and group that I've built. So I meet all of you. I learn all about what you do. I'm a total nerd and researcher. And so then I start ordering and doing all these tests. So I have like a book on my health. And then every morning when I look at my vitamin tray, I'm like, well, if you don't take that, like I know all my deficiencies, I can write them out for you.
Right.
So it's almost like if you're not careful, it can definitely push you over the edge about obsessing around your health, as opposed to just saying, what's going to keep me in balance?
Absolutely.
What's going to keep me on a straight line? And then I'm good.
Yeah. And I think we are both, like my husband always says, he's like, what's on the supplement menu this week? But I think we are better at filtering that information and knowing what to do with it, as opposed to, let's say, someone who's not in the healthcare profession and holistically minded as we are, may sort of go to Google or places where they're not getting such accurate information and, taking, the situation into their own hands and getting supplements from a place where maybe that doesn't have as high a standards as we want. Yeah. So information can be great. And I think knowledge is power, but I think overwhelming people with too much information sometimes can be a dangerous thing too.
It is true. It is true. And I meet a lot of people like that. Most
So do
people
I.
who I meet have already been through every door.
Yes.
They've gone through traditional medicine, gotten those answers. They've gone to 5 different types of holistic practitioners or alternative as well. They end up at Ayurveda's door, usually dead last is where we meet them.
Right.
And then they're like, okay, well, here's all the data. And here's my supplement box of 25 vitamins I take every day. And I always look at them like, I own a supplement company. I love supplements. I will not take 25 in a day.
It's like a meal.
Yeah, you really have to interplay just like you would with your health or your diet. There's variety, there's give and take, there's seasonality. And just remembering, like you mentioned, quality.
Yeah.
You know, I'm a big believer in doctor's level medical grade supplements, and that us going to the big box retailer down the road, I won't name any of them, but they're there.
Yeah.
All of them just selling regular supplements made abroad in who knows what factory with who knows what standards, stuffed with whatever. I don't think that that's going to give us the health that we want.
I totally agree. And I actually have a funny story. I was recording my own podcast about a week ago, and I told a story about a sweet lady who came to my office with a binder 5 inches thick with all of the tests and supplements and medications she was on. And that same day, I was treating another sweet lady who's doing great. And she said, oh, you know, I listened to your podcast recording and it was really great. Was that person you mentioned with the binder me? And I said, no, it wasn't, but it could have been.
Yeah.
So I get those people all the time who have been through every door.
Sure.
And we are very often the last door where they're looking for us to really take that binder and put that information into one cohesive story.
Absolutely. Can you share with us some interesting patient stories of yours? Because this is the part I love the most. So I, for 7 years, have gotten to run around all of South Florida and meet probably thousands of doctors by now. And I am lucky enough that I get to pull an hour of your time, usually at lunch or in the evenings, and pick your brain. And what I think 99% of the world who comes to you will never hear are your most interesting patient stories that you're proud of, where you're like, I did this and I got this. And I always feel so inspired by those stories.
Yeah. I think in a way, and this is going to sound so corny, I think in a way, every single one of my patients is an amazing story, because I truly believe that we're changing lives every single day.
Sure.
But, I have a couple of really good ones, I have to say. I think I might have told this on a podcast before, but I had one sweet gentleman who came in with really excruciating pelvic pain. And he walked into my office and he said, I'm going to kill myself if you can't help me. I've been to every doctor, every urologist, every GI doc, every colon guy, and they all tell me that all the tests are normal and that I'm going crazy. And he's like, if you tell me there's nothing wrong with me, I am going to tell you that I agree with them. I'm going crazy. So I said, okay, that's like not too much pressure to put on me.
Seriously.
But I went about the evaluation, and I know I've said this on my podcast before, but one of the things I always say to my clients before they tell their story is, if you feel compelled to tell me anything, even if you don't think it's related, please share, because those are very often the golden nuggets. Sure. So he was coming to me with pelvic pain, and he kind of sat there and looked, and he's like, well, I had very, very extensive oral surgery 3 weeks before my pelvic pain started. And I said, that's the connection. It was that craniosacral connection. Yeah. He had probably the most tension in his pelvic floor that I had ever felt in someone, because of the pain he'd been in with the oral surgery. And there's a physical connection between the cranium and the sacrum. And we released his pelvic floor. I saw him 3 times. There's another sweet.
That's a big deal.
Yeah, that was a big deal.
That gave me chills.
Yeah.
Of course, craniosacral. People don't even understand what craniosacral is.
Yes.
My chiropractor does that to me every time he sees me. He's like, let's reestablish that connection. Why don't we?
Absolutely. And I do that all the time in my office. Jessica, my incredible colleague, and I have both done craniosacral coursework. And it is such, I'm even going to say, an imperative part of the work that we do.
Sure.
I had another sweet, sweet lady who came to me, similar situation. She had like a deep, deep, deep groin and pelvic pain. And she literally had gone to every doctor. And they all said, there's nothing going on. They thought maybe she had pelvic congestion, but they weren't sure. And they were going to do an exploratory surgery. They were going to do like a laparoscopic surgery just to see what was going on because they were at their wits' end with her.
Sure.
And she saw a really great colorectal surgeon. His name is Dr. Avram Belazan. I'm going to give him a shout out because she left his office before they were going to schedule surgery. And she looked at him and said, Dr. Belazan, please think out of the box. I will do anything that you tell me to do, even if it's completely out of the box.
Sure.
And he looked at her and he said, well, if you really want to try something, try Susan Winograd and pelvic core rehab. So she came to my office, and this is an incredibly happy story, but also sad to me in a little bit of a way because I did my assessment with her. And as immediately when I assessed her pelvic floor, I recognized that she had too much tension. And we released her pelvic floor. And on the day of the evaluation, Shivani, she got up after I did some internal work on her and she said, what did you just do? What did you do? I've been searching for pain relief for so long. And she kept sort of like wiggling in her chair and was quite literally brought to tears because in the end, her situation wasn't so complicated.
Wow.
She had pelvic floor tension. So if we could spread the message to other healthcare providers that that very often is the missing link, then we could really get the people the help that they need. And she also needed very few sessions. Now, I'm really giving you the wow factor, stories, but those are just a few. I had a sweet young girl who I'm super close with to this day. She went on a vacation with her family to the Bahamas, and she developed horrible food poisoning.
Okay.
She was in so much that led to inflammation and gut imbalances and developed terrible pelvic pain to the point that she went back to college and passed out in her cafeteria.
Wow.
So at that point, I did not know Shivani Gupta. This was several years ago. I recommended her to another integrative health nutritionist, and alongside with me, she made a full recovery.
Wow.
So, I think all of the people that walk through my door are incredible stories of healing.
Sure. It's interesting, as someone who's obsessed with health, I build my health every day. I look at it week by week. I look at by seasons. I have to have my workouts. I have to have my yoga. I have to have my supplements. I have to have my eating. And I always find it funny that it doesn't matter what I do. I can do all that for Vibrant Health. There's always these chance things that come up. There's always a virus that could come along, a food poisoning that could come along. I could be walking and talking and fall over a curb and sprain my ankle. I always am entertained by the fact that there's so much chance. And you can't control for chance, no matter how hard I try to control every aspect of life. And so it must be interesting in your journey to see how many different people, it would never have occurred to me that of all the people out there, I see orthopedics the most, I see chiropractic the most because I built a turmeric supplement and it addresses pain and joint pain the best.
Yeah.
It's also effective for everything else inflammatory. But I kind of went for those people who would use it the fastest and see that quicker result. And so it's just interesting to me how many different types of people you must see for pelvic health that came from a direction that would be unexpected.
Absolutely. Absolutely. And we see people that have rib pain whose pain is driven by their pelvis. But one of our pillars of health that we discuss with all of our clients is getting rid of inflammation.
Sure.
Detoxifying the system, really having good liver health and gut health, because your body cannot be in an optimal healing position with inflammation.
Sure.
So just from, a fusionary formulas perspective, people sometimes come to my office and they're surprised. I'm here for pelvic pain. Why are we talking about decreasing inflammation? And it's all connected. And the human body's so unpredictable, right? So sometimes it's people are like, well, what caused this and what caused that? And it's always a question of the chicken or the egg.
Yeah.
And it doesn't matter. We meet people where they're at and we see what's going on with them and we address all of it.
Sure. Yeah. And a lot of people don't understand yet, and they're still coming to understand it, that inflammation is such a root cause issue. every itis in the body is inflammation. So when your ortho says arthritis and your GI says gastritis and encephalitis, when it's your neurosurgeon, name a specialist, I'm positive all of them say something itis to you. That's all inflammation. And so as human beings, the evolutionary moment I'm in is why? Why are we so inflamed? Why is gut health so trashed? How do I support and protect my children in this world? What is it I need to do even better to guarantee their future health, their future fertility, their future vibrancy? I really do think about those things.
So do I.
Since they were kids, I thought, I was on a fertility podcast yesterday and I said, since they were born and since they were pre-born, I was detoxing and preparing for them to not be affected by plastics and BPAs and all these things. I've built our entire life around this. And there's still health issues that come up.
It's all around us.
Yeah.
I think we live in a climate today that's probably the most difficult to remain healthy and vibrant, because as hard as we try, there's so much around us that's so hard and sometimes impossible to filter. So we just do the best we can.
Exactly. And that's why it's fun to meet practitioners like you, because then I feel like I'm less crazy.
No, I mean, maybe we're both crazy. I don't know, but I'll be on your crazy train because I think we're on the right train. We're taking the right ride.
Yes, for sure. So you mentioned fusionary formulas. I always love hearing from my practitioners one or two of those fun stories of how it was able to help someone in your, ecosphere of who you're helping.
Yeah. So when we met, Shivani, it's probably about a year ago now, and you started telling me your story and about your background and how you developed fusionary formulas. I honestly immediately knew that it was something that I wanted to incorporate into my practice, because as I mentioned, our pillar of health, one of our pillars of health is decreasing inflammation, nutrition, movement, mentoring and coaching. Yes, hormones. And hormones can't do what they need to do if you have inflammation. Your food can't do what it needs to do if there's inflammation, right? Food could be medicine or it could be poison.
Correct.
And with inflammation, it's hard to optimize any other system in the body if you have that pervasive inflammation. So I knew that all of my clients would benefit from it. And I'm pretty lucky that I get a well-educated clientele in terms of their own health.
Good.
Most of my clients are very health conscious. They have a high emotional intelligence in terms of their health. And when I tell them, I know that you can get turmeric on Amazon, but you don't want to. I know where this, inflammation relief and the fusionary formulas, I know the formulator. I know that this is the best quality that you can get. And I know that it's going to do the best job for your body. And it's been so well received. And I think that one of the things I tell my clients is that there are a lot of little things that we are going to put together to optimize your healing. And the inflammation relief has become one of them. So I think it's one of those things that I put into the big picture and, make recommendations for their overall healing. But I would say that it would be beneficial for all my clients.
Sure.
It's an amazing product. I'm obsessed with it. I take it personally. I've also made quite a ritual for myself with your hormone balance tea and your deep sleep tea. I have my hormone balance tea in the morning and I have my deep sleep tea at night. In fact, I have tea diffusers all over my office, all over my house. I've developed quite a collection to try to make the best cup of your tea. And I also use your deep sleep melatonin formulation, which I love. I actually last night woke up at 2:00 in the morning. I put a couple drops underneath my tongue and went right back to sleep. So I do not recommend anything to my clients that I don't use personally. And I use your products personally, and it's phenomenal. You've done an amazing job.
Thank you. I really appreciate that. I love hearing how it impacts people. I am personally obsessed with deep sleep tea and hormone rebalance tea. They're some of my favorites.
I love it.
In the office, we have collections of steepers everywhere, and half the time we're too lazy to clean them. So they stockpile, then we have to go clean all our tea steepers.
That's hilarious. One more thing about your tea, Shivani, is, and I think I've mentioned this to you, when I met you and you told me about your teas, I'm like, let's see how they're going to taste. Because there's no way you could put all that good stuff in tea and it is delicious.
Yeah.
So I don't know how you put so much good stuff in it and still made it taste great, but it is delicious and soothing and beautiful. I mean, the tea leaves are beautiful.
Yeah, that was my goal. I thought, people complain that they take too many supplements. And my point is take a lot less junk and just take what works. That's my first point always is I take my turmeric above all, and then everything else is optional. And I go downstream from there, turmeric, probiotic, D, and then I keep going down my line of what I consider important. But with tea, I had a curiosity. I was like, can I invent a tea that will create an impact? Can it function like a supplement in the body? Can I drive a result while having it taste good and having it perform? Because I'm all about potency while being palatable. Potency that you'll still be consistent with and compliant with. So Fusionary is not a tablet because I wasn't going to take it if it tasted like gross curcumin in a very potent, weird form. I need to encapsulate it.
Yes.
Let's just have it go down quick. And then with the teas, deep sleep tea has so much Ayurvedic support in there. It was going to taste gross if you didn't drop a lot of florals on top to balance it and deliver the result while also making it taste good.
It's so interesting that when you say the florals, because every night when I make my tea and I open the bag, I'm like, it's so pretty.
It's so pretty because that's
so pretty.
That's covering up that ashwagandha, that brahmi, that all those things.
It's still delicious.
Yeah.
It is absolutely delicious.
Awesome. Well, thank you. Thank you for sharing that. So when it comes, let's bring it back to you for a moment. When it comes to pelvic health, what are some of the key takeaways that you wish everyone knew, that you think to yourself, wow, I say this every day. And if I had a megaphone, I would announce it from the Empire State Building.
Yeah. So I think my patient this morning that I saw before we came to record said it really, really well. She's a sweet young girl and she, was about to walk out of her treatment and she said, I wish everybody knew that they could benefit from this. And it was so profound. Yeah. I think, we take care of the rest of our bodies.
Sure.
And I wish women who are pregnant should know that they can help themselves just by getting a pelvic floor exam, pelvic floor physical therapy exam during pregnancy.
Sure.
That in the postpartum period, every single mama needs a pelvic floor physical therapy to recover optimally. Sure. And that you don't have to wait till menopause for symptoms to come up. Be proactive. I think that would be my number one message is be proactive. And for men that have pelvic pain or bowel and bladder dysfunction, I find my men in particular wait a little too long to seek help. Yeah. And if you're just proactive and we can nip things in the bud, healing is possible. Healing is absolutely possible.
Absolutely. So let me ask you this. I'm 42. So my whole crew of friends is between 42 and 52, I'd say, for the most part.
I'm on the higher end of that, Shivani.
But yeah,
I'm not going to lie.
All my friends in their 40s are like, perimenopause, we're suffering. I'm like, no, I don't see suffering. I actually don't believe that any disease or pathology is inevitable. I think everything that's coming for me, menopause or whatever way in the future, I can fly through with flying colors, that it's all a choice of how much I'm willing to invest my time and effort to have that vibrant health. And if I'm de-inflamed, my gut health is on point, my sleep is on point, and all systems are running beautifully, I don't see why anything would throw me for a loop. But from what I see, perimenopause and menopause are throwing everybody for a loop. I'm getting a lot of complaints.
Yeah.
And that's why I designed Hormone Rebalance Tea. Yeah. I really designed it for the menopause crew who said, I am having hot flashes. I'm having night sweats. I'm suffering. And I said, I'm not there yet, but I know how to design Shatavari and the correct adaptogens to support you. And then for all of us in our 40s, it'll support us as well because it's just balancing to the system.
Absolutely. So, obviously I see a lot of that and I completely agree with the message that you just conveyed in that your body can rebalance itself. I think a lot of times women, as they approach perimenopause and menopause, have had issues and imbalances that they have let go on for many, many years. And I see this particularly with birth injuries.
Sure.
And what happens is that when you're young, your body can compensate a little bit better. You're a little more resilient. And then as you get older and your hormones really start to change and you lose estrogen and you haven't been proactive to optimize your health, then symptoms really start to come up, whether they're pelvic related or hormonally related. Sure. And we can help those women. We help those women, you and I, we help those women all the time.
Sure.
Even if we have to work a little bit harder to peel those layers back because they haven't been quite as proactive, but your body can rebalance itself. And I think every season of life should be incredibly vibrant. I know I feel better than I ever have, and I'm going to be 50 this summer.
Sure. Yeah. I feel better. I feel like I look better. All these things get better with age with me. So it's interesting to watch the journey as I dive deeper into my health and I distill and I become, it's like a distillation. I used to do so much and now I focus in on just what's going to drive the result.
Yeah.
I add in some variety, some extra. But here's a question I have for the women or people or men who might be shy, who might think, what are you going to do to me exactly? Where are you going to put a gloved hand? Like, what's going to happen here? Can you kind of help that crew? Because I'm going to get that question after this episode.
Absolutely. So the one thing I would say is that we make people feel super comfortable. That's number one. Number two, if you have any hesitations, call our office. We do 15-minute free consultations.
Okay.
And I think also just as importantly is that the client is in the driver's seat. So we make recommendations of what we usually do with clients, but if they are not comfortable with something, then they know that they are in control. And I always say there's more than one way to slice an apple. We can do things differently. And 99.9% of the time, by the time we've gotten up to that pelvic exam, they're like, you know what, let's do this. I feel like I want to get the best result. Sure. But we always start by listening. I want to hear their story. We do a full external exam. We do a regular musculoskeletal exam. We do a fascial exam. We do a visceral exam. We want to feel the fascia around their organs. And then typically with the client's permission, we will do either a vaginal or rectal pelvic floor exam because that is the easiest way to get good information from those muscles. And to us, it's just like manual muscle testing, like any, testing the strength in your biceps or testing the tone in your hamstrings. Okay. But I think it's important for people to know that the most important thing for us is that they feel comfortable and they feel like they are in a safe and non-threatening environment.
Sure. Yeah. Because otherwise I feel like this is something people would avoid, when in fact, it could be something that could help them so much earlier on. And it's interesting. You're kind of saying preventively, anyone who's had kids, anyone who hasn't had kids, but has had any sort of trauma or health issues that have led to, it's not quite dysbiosis, but dysregulation in that area, whether it's bladder or, constipation or any of these issues. They can come in and have these conversations. Absolutely. We don't have to go further than a conversation.
No, we meet everybody where they're at. And I would even say it's at that point, if you've had an injury, if you've had trauma, it's more than preventative. It's restorative.
Sure.
Preventative is, we do get clients who are like, I feel great, but I go to my primary care physician once a year and I'm going to come to you once a year because I want to stay feeling great. That's more of what I consider preventative.
Sure.
Someone that has had an injury or a trauma, I would say that's 100% restorative.
Sure. That makes total sense. Beautiful. Okay. Well, I feel like I could talk to you all day long.
I agree, Shivani. We're going to have to do this again.
Yes. And it was lovely being on your podcast. Share the name of your podcast.
Thank you. My podcast is called Your Pelvic Health Podcast, and check out my episode with Shivani. It's definitely a fan favorite.
Nice. Beautiful. So any other key takeaways that you have for the clients out there and the people out there who are listening who just have not heard about this before, might be like, okay, I'll consider this. I'll think about this.
Yeah. Just remember that everybody has a pelvic floor. Men, women, children. It is part of our deep core system. It's what supports us throughout life. It is, our second heart, and we need to take care of it. And the next message I would say is be proactive. Be proactive about your health. Take care of yourself because you can live a vibrant life. And then lastly, I just want to say what's common is not always normal. Pain with sex is not normal. Constipation is not normal. Any bladder leaking is not normal. So let's not normalize it. Let's take care of it.
Sure. And when you mentioned deep core, before we wrap up, I had back pain right after I had my first child. I threw my back out and it was so shocking to me. Then I took whatever they gave me. It was like opioid, muscle relaxer, injection, whatever was on the table. I took it because I just wanted to walk. And afterwards, I realized, first of all, drugs don't do well in my system. Second of all, what could I have done to prevent it? And I went to physical therapy and they said, you need core muscles.
Yeah.
And so I do so much work regularly to have a strong core. And it didn't even occur to me that pelvic muscles, of course, are part of core. In yoga, we engage Mula Bandha. In spirituality, we talk about manifestation in the chakras, going from the bottom to the top, but being able to hold the bottom of that core, that Mula Bandha, is part of that, it's part of spirituality, it's part of yoga, it's part of overall health. And of course,
absolutely
core engagement.
Part of your intuition.
Yeah.
Right? Knowing how to really engage and use your core to support you throughout life, I think gets you better in tune with life. I will go so far to say that, and just gives you better intuition about what's going on with your body and how to support it during all activities.
Sure. Absolutely. Beautiful. Well, thank you for coming on today.
Thank you, Shivani. This was great.
Yeah. Thank you for joining me, everyone, for this episode of Fusionary Health, where we discuss all the different ways that you can build vibrant health in your life every single day. You can find me on Apple, Spotify, or anywhere that you listen to podcasts. And please remember to like, follow, and leave a 5-star review so we can continue to grow this podcast for the world. This episode has been brought to you by Fusionary Formulas, an incredible supplement company that has created a potent turmeric supplement to change the world. So thank you for joining us today.